Hey, this is Greg McKettrick. I'm the Men's Health Clinical Liaison for Revelation Pharma, and this is my presentation, Deep Dive Oral and Sublingual Options for Erectile Dysfunction. Here are our legal disclaimers and presentation objectives. We're going to talk about what the options are, some of the non-prescription or the herbals and supplements, talk about the BV or before Viagra treatments, and then the AV or after Viagra treatments, and then some of the different dosage forms like the sublinguals, both troches, oral disintegrating RDTs, and then the liquids, the sublingual suspension, and then benefits of the combination therapy and some of the cost factors. So let's talk ED. Erectile dysfunction, obviously, it impacts a huge number of men globally, hundreds of millions, over 300 million, and growing. So this represents a huge uh, economic market. Um, as of 2023, the ED market for medications was over $3 billion. And I said growing, so to give you an idea, by 2033 or 10 years down the road, this number is going to double, more than double, projected to be almost $7.75 billion. And there's a number of reasons why this is going to happen. Um, Number one, people are just more aware. It used to be this was really a taboo topic, but anymore it's common and it's all over the place. So awareness and knowledge and information is much more readily available. Second big reason is there's a rising prevalence that the lifestyle diseases, diabetes and high blood pressure, heart disease, obesity, huge, and even certain cancers really lead to more incidents of erectile dysfunction. And another contributing factor to the lifestyle diseases actually really is the increased adoption of sedentary lifestyles. We're just not a very active, outdoorsy society anymore. So we're seeing much earlier onset issues with obesity, and that's leading to diabetes, leading to blood pressure, all the rest. So kind of causing our own problems. And then, as I kind of mentioned with number one, the awareness, but also increased access to therapy. I mean, everywhere you look, if you're online or if you're watching TV, there's another ad for some new ED line, whether it's hymns or Roman or mint or all these different things that are coming out. I mean, they're all over the place. Lemonade. So it becomes much more readily available for patients, easier access. And also, you see a lot more of these dedicated men's clinics popping up all over. They treat a lot of ED and hormone therapy, that sort of thing. Another big component is the fact that a lot of the leading ED medications are now generically available and they're cheap. So much easier um, to actually not only access but to afford these treatments. So again, based on these numbers, huge demand for products as well as information. So both resources and the available products getting to the market. Um, Many patients will try and go the natural route or herbals and supplements um, prior to even stepping into the oral or sublingual medications, and they'll certainly opt for that prior to going into any more invasive type therapies like injections. And there's a lot of different OTC products that are available. So this is a great opportunity from pharmacy standpoint to be able to educate both patients and providers. So when you get patients that are just kind of tiptoeing into the whole ED issue, especially, you know, back in the day, I was around before we were dispensing Viagra, so we saw a lot more of this, but it still is very common today. But people who are starting to experience the basic symptoms, early symptoms of ED really go towards more the supplemental side. Um, Even more so back in the day because it was more discreet than trying to go to a medical professional and have an unpleasant conversation about ED. Um, so some of these patients they were starting to see some issues. Maybe it was a little bit of performance anxiety due to waning performance in bed, but again, it caused them to start searching. And again, a lot of patients want to try other remedies before they go the big pharma route. So supplements and herbs kind of filled that slot. So prior to the availability of Viagra, BV, as I said, um, a lot of the treatment regimens really did. They fell into the herbs and supplements and that sort of a thing. So a lot of roots and herbs that were kind of mimicking some of the function of current medications, maybe to a lesser degree. And here's kind of a list, and you'll see a lot of these do have some effects that are very similar to PDE5s, maca, Uricomia longifolia, um, horny goatweed. Others, like pycnogenol, they kind of more boosted blood flow. So kind of came at it from two different directions. In terms of prescribing, yohimbine was very commonly prescribed back before Viagra was on the market. That's an alpha-2 adrenergic receptor blocker. And it did increase the blood flow and nerve impulses, allowing for better erectile function. Of course, it had some side effects that weren't real popular, but at the time, people were willing to deal with it. Since then, it's fallen out of vogue due to cardiac issues and other side effects. But before Viagra, boy, that was the thing to get prescribed. Another one, ashwagandha, is very good for, again, sexual function and for libido, and it's actually used by both men and women. And then some of the basic vitamins that really support healthy function and healthy erectile function, vitamins D, C, E, and some of the B vitamins. One of my favorite topics to talk about is nitric oxide. If you've heard me talk before, you know I probably talk about nitric oxide in every single presentation I do. So it's an essential gas in our body, and it is extremely important for good cardiovascular health, circulatory function, cognitive function, as well as sexual function. Nitric oxide works with the cyclic GMP in our system for proper erectile function. As with so many things like hormones, nitric oxide production in our body declines with age. So by age 40, we're down to about 50% of endogenous production. By age 60, we're down to maybe 15%. And that is something that is somewhat variable. Worse for a lot of us because of our diets. We just don't eat a good green, healthy diet that supports nitrates in our system. And plus a lot of medications, proton pump inhibitors, and even antibacterial mouthwashes. A lot of these things inhibit the production or shut off the production of nitric oxide. So a lot of factors that play in there. A lot of the nitric oxide supplements on the market are amino acid based. So very commonly you'll see the L-arginines, citrulline. They've been around for a long time, and they're great for particular portions of the population. A lot of them are very popular with the workout crowds and their pre-workout formulas and that sort of thing. Then the other side of that coin are the dietary nitrates, like spinach and beets and arugula. Potassium nitrate falls in there. The nice thing about the dietary nitrates is they're really appropriate for any age group, whereas the L-arginine based products or amino acid based products, they are reliant on the NOS, nitric oxide synthase pathway, for conversion into the body, and that slows down and kind of becomes ineffective around the same age that we're seeing these big drop-offs in natural production. So amino acid-based products are great for younger, not necessarily the best for the population of patients that I work with, which are more in the 50s, 60s, 70s, 80s. So dietaries are better. And I also make a big deal with my patients of recommending the good healthy diet, eating nitrate-rich foods. Um, so that's one of the things that we try to talk to patients about early on. Of course, anymore, the supplements, not only are they easier, taking a couple capsules a day, but it's probably actually cheaper anymore. Buying good food is expensive as all get out. So other options, now, don't hear too much about this, but cannabinoids, like CBD products. Human sexual response has four parts, and there's libido, arousal, orgasm, and resolution. So, dopamine is a huge impactor on sexual desire and libido. Acetylcholine has a huge impact on erectile function. GABA controls orgasm release. Serotonin works on sexual resolution and refractory period in men. Well, guess what? Cannabinoids kind of hit on all of these. So CBD products can actually function in this realm very well, and I've used them for years for my patients. CBD typically you hear a lot of the stimulation of serotonin, oxytocin, anandamide, and really not only boosting function but also the kind of relaxant effect or the ability to reduce performance anxiety. I mentioned anandamide, and that's the bliss hormone. So it reduces the ejaculatory threshold, makes it easier and enhances orgasmic function. Um, and there are specific CBD products because CBD is kind of a generic term. We use it to cover all of the cannabinoids, whereas we know that there are particular cannabinoids that have more function for particular activities, and CBG is one that we see a lot of relation with anandamide, which we focus on a lot, and also on GABA. So the GABA helps again, as I mentioned, with orgasm, and then anandamide is your pleasure center. So great to incorporate these. I've used them a lot in my patients in different combinations in therapies. So uh, using the cannabinoids with PDE5s or with injections, as well as with things like oxytocin, can really enhance orgasmic function in a big population of patients. Other supplements, DHEA, it's a naturally converting hormone in the body. It is kind of a precursor hormone for androgens and estrogens. Um, Again, this is one of those things where we see a steady decline actually after the age of 25. And it's really thought and believed that boosting that DHEA level can help erectile function, typically a dose of about 50 milligrams a day. Another one is ginseng, been around obviously for centuries. Um, the different types of ginseng, they do have slightly different effects, and we're really looking at the red ginseng, which it's harvested after at 6 years, and then it's steamed and dried. And then this process actually boosts the anti-inflammatory characteristics. Um, and ginseng is what's called an adaptogenic compound, so it really helps the body to normalize and reset. The studies have shown that it can be beneficial, 600 milligrams of daily of the red ginseng, benefiting in all aspects of sexual function, including erectile function. Carnitine is another, alone or in combination with L-arginine and niacin. It's definitely shown some significant effects, and especially if you combine it with something like PDE5, like sildenafil, you get a much better response rate. But here's the big negative with the OTCs, which again we have to be an advocate for our patients. There is so much out there, and it's, everywhere from your local gas station to the back of a magazine to some online ads. All of these, you know, the best OTC option, the this is better than the prescriptions. Well, sometimes the stuff is actually tainted with drugs. Some of them, the marketed medications we see, other ones that are not even approved for use. I went through and looked through the actual list of the products that are tainted, and I was amazed. I mean, just what's known, and keep in mind this changes, like as soon as somebody gets busted, they just change the name of the product. So, but it's a 44-page long report by the FDA that talks about these products that, either they contain sildenafil, or they contain nortadalafil, or they contain similar ingredients that, either they're slight isomers, or slightly different than approved drugs, or some of them are not approved. So these are huge risks because there's no knowing how much is in there, the purity, and of course, patients have no idea they're taking something that could actually cause some pretty major health side effects or interactions. So now getting into the prescription stuff, the good stuff, right? This is where we go uh, after Viagra, or once the approval and adoption of Viagra. We know that the endothelial tissue and nerves in the body release nitric oxide, again, my favorite guy, and this stimulates the guanylyl cyclase to produce cyclic GMP, and then this triggers the relaxation of the smooth muscles, allowing for arterial dilation and the constriction of the blood vessels, leading to erection. So Pfizer in 1989 was studying a medication for pulmonary hypertension, sildenafil, and they knew that this worked to enhance the blood flow into the lungs. Of course, what ended up happening was they had some very happy study participants who were wandering around pitching tents, and they said, "Hey, this might be something else that we can market." And sure enough, they did. So we ended up in 1998 with Viagra hitting the market, which was like a tsunami in the sexual function world. Followed closely by the more selective PDE5 inhibitors like tadalafil and vardenafil, and eventually avanafil. And these have all now come to the market. All except avanafil are available generically. So, obviously, I was talking about before, prices have come down a great deal. So, how do these things work? PDE5 inhibitors. They're blocking the phosphodiesterase type 5 enzyme in the body. And, they function by blocking the degradation of that cyclic GMP, which is in turn triggered by nitric oxide. So they're enhancing the duration of effect for the erectile response. There are side effects with these, obviously. We know about flushing and blood pressure and sinusitis, stuffy nose, palpitations. More serious are some of the ocular side effects that can occur. They're not common, but we do see them. And if there is any report of this, it is very, very important that you direct that patient immediately to a medical professional, ophthalmologist preferably, so that they can be checked out. And here we kind of have our list. So, sildenafil, which was initially marketed as Revasio and Viagra, was the first PD5 to hit the market. The Revasio came out as the 20 milligram tablets. And then Viagra came out as 25, 50, and 100 milligram. So relatively rapid onset of action, 30 to 60 minutes, with a duration of action from 4 to 8 hours, typically in the 5-hour window. It's best if it's taken an hour prior to sexual activity and on an empty stomach. So an hour before, 2 hours after eating. Why is this? Well, because it doesn't absorb well if you've got food in the stomach, especially fatty food. Also, the enzymes in grapefruit juice do not play well, so avoid that. Big side effects: nasal congestion, headache, flushing, dyspepsia, back pain, and again the visual changes. Very well known, the blue pill and the blue tinge in the vision. So um, watch out for visual changes with any of the PDE5s. Tadalafil came to market next under the names of Cialis and Circa. Range of doses from 2.5 up to 20 milligrams. Onset of action similar, but in reality, the peak of the activity takes a little bit longer than the sildenafil. So I typically counsel patients to take this well in advance of sexual activity to allow for peak absorption. Duration of action, this is the biggie. So tadalafil can stay in the body for up to a day and a half, up to 36 hours. Even longer for some patients, but I mean, this allows for spontaneous response long after taking the dose, which led to them really focusing on the daily dose, like the 5 milligram, sometimes 10 milligram high. Rarely, unless somebody's having a lot of side effects, I hardly ever see the 2.5 milligram used. But taken daily, it accumulates in the system, and it allows patients to have better spontaneous or more natural response to sexual arousal and for sexual activity. The PRN doses typically, again, are the 10 and 20 milligrams. Similar side effects, higher doses in particular, you get a lot of heartburn, back pain, and leg cramps. The vardenafil, which is Levitra for the oral tablets, or Staxin for the sublingual, or ODT, oral disintegrating tablet, more selective than either sildenafil or tadalafil, which means it's better tolerated, so less side effects. Very similar in terms of onset of action, faster with the ODT, and the duration of action similar to that of the Viagra. Again, this is a newer one, so even the generics are still a little bit pricey, but it is one of the preferred by a lot of urologists simply because it has the lower side effect profile, leading to Avanafil or Stendra, which is the most selective of the PDE5s currently on the market. So similar in effects, similar in some of the counseling points, like taking an empty stomach, but much lower side effect profile. So, where are we going? Obviously, hey, if the market is going to double in terms of the economics over the next 10 years, and we're going to see this explosion of patients, I'm sure that there's going to be more and more drugs coming out, right? Well, sure, of course there is. And where we're seeing this, actually, we see some from Brazil and Korea actually have PDE5 drugs on the market. So just like the current selection in the States, these drugs differ slightly in terms of selectivity and potency, onset and duration of action. And that does impact a little bit in terms of some of the side effects and potential adverse effects as far as their profiles are concerned. So some that are out in other countries, the Miradenafil launched in Korea actually back in 2007 as MVIX and MVIX S, which is the oral disintegrating film. Much more selective than the sildenafil. So similar efficacy, lower side effects. So again, you're talking, here's one that offers a lot of the benefits, but like the vardenafil and Avanafil, has lower side effect profile. Lodenafil, which is marketed under the name of Heliva, this actually is studied and produced in Brazil, and it's in phase 2 and 3 trials. So, they've been completed, and hopefully we'll see this hit market in other areas besides just Brazil. And then Udenafil is another Korean PDE5. Actually introduced in 2005 under the trade name Zydena, and it is currently marketed throughout Korea, Russia, and in the Philippines. Um, it went through phase 2 and 3 studies in the United States back a couple decades ago, um, but the FDA was looking for more research to be done. Ended up that the FDA accepted a new drug application for udenafil for heart disease, for single ventricular heart disease. Um, so used to improve exercise capacity and respiratory response. Um, Similar in terms of receptor activity to Viagra, but duration of action is closer to the Cialis, so 24 hours or more. So once this hits the market, then we'll probably at some point see this join the ranks of the PDE5s that we commonly use today. So, the existing PDE5s and the new ones, they do share a lot of similar characteristics. The side effect profiles are different, and onsets of action and durations of action um, do differ to a certain degree. The neat thing about this is pretty much every one of these drugs is under investigation for use or to be accepted and approved for other conditions. They're seeing more and more for respiratory function, cognitive function, exercise tolerance, lots of different things. Um, and this will, as drugs are approved for new considerations and for new uses, this will open the door uh, for other drugs to come into the market. The global use, again, we're talking over 330 men worldwide. The studies really drive this market demand, and obviously they offer a lot of incentive to companies to bring products to market. Um, so we'll kind of take a look at a couple of the global and some of the different applications on these next slides. So again, erectile dysfunction. What are our physical causes? Obviously, age is a big one, but obesity, smoking, sedentary lifestyle. Certainly, it is made worse by comorbidities like heart disease, diabetes, high cholesterol, high blood pressure, and cirrhosis. Also, there can be a lot of incidents due to medication therapies. And in fact, there are some neurologic conditions that contribute. So, Alzheimer's disease, MS, Parkinson's, stroke victims all have higher incidence of ED. And then again, my area, surgery, the history of surgery like prostatectomy or pelvic irradiation uh, causes a lot of ED issues for patients. And then the psychological causes. So, talked about CBD helping, but, anxiety and history of sexual abuse or formative sexual experiences, marital problems, stress, kind of get into all of the substance misuse issues that can go along, and that all feeds into more and more ED. This is kind of neat, kind of shows a picture in terms of the prevalence of erectile dysfunction around the country, um, around the world, sorry. And you can see that there are some geographic factors that play in, and it varies obviously. And I think it's dependent so much on lifestyle, cultural differences. I think if you look at a lot of those disease states that feed into high incidence of erectile dysfunction, you probably be able to make a pretty direct correlation to why we're seeing the kind of numbers we do on a global basis. So PDE5 inhibitors, Viagra, Cialis, Levitra, Stendra, these really are first line therapies for most men. Decent rate of success with them. Sildenafil for most men in that 65 to 70% range will respond, at least for a while. Typically, one of the things that we see happen is Viagra. Men are prescribed Viagra, whether they're 45, 55, whatever the case is, and it usually will work for about 5 years, and then it really starts to fall off. Which, I don't think anybody's done a real study on it, but I think that there's a direct correlation between that and um, linear degradation of nitric oxide production in the system. It is dependent somewhat on the cause of issues that are the underlying cause of the erectile dysfunction, and Viagra is indicative pretty similarly of the other PDE5s. Again, probably the biggest issue that I've run into since Viagra's been around, and even today, so many people, so many men I talk to will tell me that nobody ever told me not to eat before taking a dose, which every doctor I say that's the first thing I tell them, and every patient says nobody ever told me that. So pick your poison. Um, Obviously, the oral dosage uh, tablet versions do have some issues as far as stomach content, especially with high fat content foods. Um, the other thing about tablets is, they're subject to fat first pass metabolism. So, not only is it dependent on what's in the stomach, but then it's got to go through the gut and the liver and everything else. So, um, our body will eliminate up to a third of that medication before it gets to the bloodstream. So, sublingual versions that bypass the gut, whether that be the troches or the ODTs, as we mentioned, or sublingual suspensions or the films, really reduce the onset of action. And sometimes it's twice to three times as fast getting into the stream, getting into the bloodstream. And again, the nice thing is you can still go out and eat dinner. And then the other really neat thing about the compounded versions, especially the sublingual troches that I've been working with for years and years, is the ability to actually combine different ingredients. So here are some examples of troche doses. Now keep in mind that troches are divided into four equal size compartments, or they're scored into fourths. So it's really easy when I sit here and I'm talking about a quarter or a half of a dose to divide these things. Also keep in mind that the sublingual dosage form is higher in terms of rate of absorption, and because you're not going through first pass metabolism, higher bioavailability. So a smaller troche dose not only gets into the system faster, but it hits with stronger concentration. So you can kind of see here, these are the commonly prescribed PDE5, sildenafil, tadalafil, daily dose tadalafil, vardenafil, but then you get into these combination ones like sildenafil and tadalafil. So you get rapid onset with sildenafil, and then that duration of effect with tadalafil. So here's something that you take it on Friday night, and hey, Sunday morning you're still in the game. So they're very popular. Same thing with vardenafil, tadalafil, very similar premise. Vardenafil being the rapid onset, and then the tadalafil the longer duration. So those are great. Men love them. Kind of get a lot of bang for the buck, so to speak, with these medications. The other thing, as I mentioned, is being able to add other active ingredients. So very commonly, we'll use things like a dopamine agonist, like apomorphine, where you're not only maybe boosting some of that libido due to the dopamine surge, but also stimulating uh, in the hypothalamus, where the initiation of the erectile cascade is centered. So it actually has been studied as an independent agent, not typically used independently, but it is rather rapidly absorbed. So you do get a nice effect in terms of both erectile function and sexual desire, so libido. Caveat, you can get some nausea with higher doses. So we try to keep the doses relatively low in that 3 to 4 milligram range to avoid that. Other things, testosterone. You know, sublingual testosterone, as I have talked about before, terrible for testosterone replacement therapy because number one, it's very rapidly metabolized, so you would have to take multiple doses in a given day for actual TRT. But for sexual function, again, rapidly absorbed because of the sublingual route, gives a great boost to energy and libido, and then it's rapidly metabolized. So you're literally getting just a quick surge, and then there's no depot effect. Oxytocin, the cuddle hormone as it's known, another great active ingredient that we can incorporate. And it's a neuropeptide. It's involved in all aspects of sexual activity, from penile erection to ejaculation and sexual satiety. So like nitric oxide, like testosterone, this is one of those natural elements that our body stops making. We just don't see the same levels as we age. Because of the fact that this is very rapidly absorbed and the onset of action is very quick, we really look at nasal sprays or sublinguals as the best route of administration. And we do have to keep in mind it's a temperature sensitive medication or drug. So we don't want to use any kind of a heat element in the compounding. Otherwise, we can degrade the actual medication. Now, I've listed here, this is a neat combination that I really like. So, like I talk about being able to put things together and get better effects. So here's vardenafil, oxytocin, and apomorphine. We use this for both men and women, but you get obviously the effects of the PDE5. So, the erectile response, better blood flow. The apomorphine has the libido effect plus erectile stimulation, and then the oxytocin, which stimulates all forms of sexual function, all in one dosage form. Now, I mean, this is pretty cool. Being able to use something like this, it's used immediately prior to sexual activity. It's not a daily dose type of a thing, but we get great response from that for both men and women. So, what do we see? We see a huge increase in the prevalence of ED. Why? Because we're just getting into very kind of a sit on the couch kind of a mentality as society. So lifestyle changes have a huge effect on this. The nice thing, though, is that people are much more aware of what the options are. So, that's one good thing. Prior to Viagra or BV, prior to 1998, really the only thing that we prescribed was yohimbine, and never had huge success with it, and also had a lot of side effects. So, boy, it was a absolute fantastic time to hit 1998 if you had sexual dysfunction. Why is this such a huge market? Well, didn't take much to know, but once Pfizer brought Viagra to market, within 3 months, it had already earned $400 million. And over the last 20 years, averaged $1.8 billion a year. So lots of money there. Number of American men dealing with sexual dysfunction or EDs by 18 million, and then worldwide over 300 million. We are seeing more and more development, and I'm sure that this will continue because of the fact there's such a huge market demand. Now we've come a long way since the advent of Viagra, but again, with increased prevalence of ED and sexual dysfunction, there will be a lot more attention paid in the future. Not to toot my own horn or anything here, or our own horn as compounders, but I find it interesting that a lot of the online markets, these special clinics today, really what they're advertising are these combinations of different PDE5s and oxytocin and apomorphine. I kind of laugh. I'm like, hey, we've been doing this all along, guys, so you've been looking in the wrong place. But it's nice to see that it's actually becoming better known. So I, for one, am really excited. I'm looking to coming up with new solutions. Hopefully, we'll have new tools in the toolbox that we'll be able to share with patients and prescribers very soon. Thanks for your attention on this. Here is our references. And this is Revelation. Any questions or how to get in touch with us? And here's our list of pharmacies and growing every day. Well, thanks, guys. Thank you so much for your attention. And I look forward to speaking to you again next month.